I'm Rose Hernandez. I was 40 years old when I was told that I had the BRCA gene. And at that point, I knew I had to have a double mastectomy and reconstruction. Well, when I first came into the office, I was anxious. I was worried about having major surgery. Soon after we started our initial discussion, I started feeling calmer and less anxious.
So when I met Rose, she brought her significant other with her and shared her journey so far. She'd done some research into different reconstructive options, and so we had talked about a couple of possible ways that we could do a reconstruction, but we also spent quite a bit of time talking about their life and their goals, their activities. They have young children at home, and so that was an important consideration. They both work. Rose is a psychologist and a therapist, and so she spends a lot of her time taking care of other people, and this was a different role for her to be the one who was going to be cared for. And I think that was an important thing to understand about what she needed in her care.
When I left the office, I felt like I was heard. My concerns were validated as far as my anxiety about it. I had the information that I wanted. Dr. Fisher answered in detail all the questions I had, described all the procedures that I was going to be having, and up to as far as even drawing the diagrams of everything that was going to happen. And that was really helpful to have a better understanding and understand that that was a process I was going to go through and it was going to be okay.
And so because Rose had the gene for breast cancer, but did not have breast cancer, she had many different options available to her. She could have taken the pathway of an implant reconstruction, or she could take the pathway of a living tissue reconstruction or a DIEP flap reconstruction. We talked about both of those possible pathways to restore her breast shape after mastectomy, and she felt strongly that she did not want breast implants. She did not want to have an artificial device or the possibility of coming back and doing reoperations later for something like a leak or other issues, and so she preferred the living tissue reconstruction. And so we talked about that in great detail. We spent at least an hour together. I drew out the shape of the body and sort of explained really what a mastectomy is. Right. Removing the gland but keeping the outer breast. And then we talked about the DIEP flap and how you can do what is almost like a tummy tuck, but then take that tissue with its feeding blood vessel, place it into the chest, and create a living soft breast. And then there's the artistic component, and so we talked about that because Rose wanted a certain size and shape. I think you had wanted to be about a cup size bigger, and so I hope you're happy 4 years later. I hope it's
definitely
good.
My first memory of Dr. Fisher was her friendliness, right? But also, I remember a story she shared, and she said, I want you to know that I'm going to treat you like you were my sister or my mother and give you the best care that I can. And so just in that moment, I was like, this is it. This is the person I want to work with. And also acknowledging that my partner was in the room and accepting that both of us were going through this together. And that was really important.
Both of my grandmothers had breast cancer. And so it's always been something I was aware of as a significant life event that really affects the way women feel about their bodies, about their health. And that has had a big influence on motivating me to be a part of taking care of women.
I would say my primary concern that I had, physical concern, was whether it was a possibility that having breast reconstruction results look natural. Especially since through media, you see all these shows on these botched type of plastic surgery, and so that was my primary concern. And 4 years later, I feel confident, and I feel it's exactly the way I wanted it. And I feel natural. I feel like I'm a whole person, a woman that's whole again.
I think one of the nicest things about the living tissue reconstruction is that it is made of
Tissue.
tissue. So it's a replacement of like with like. When you remove the gland from the breast and you replace that gland with soft living tissue, which is that tummy fat, the breast feels like a real breast because it is a real breast. The outer breast is still there, but then the whole breast feels alive and soft because it's still made of you. And patients seem to feel more whole. And I hear patients say they're really much happier with the way they look and feel. Even patients who've had implants before who've come back and said, these just didn't feel like me, they feel like something. And then when we've switched them to the living tissue, they feel more real somehow.
Exactly.
The breast's warm, the breast's soft, the breasts regain some of the sensation. And I just think that's the best that can be done for somebody, is to help them feel whole and feel like themselves. And one of the most satisfying things that for me as a provider who I really enjoy taking care of people is seeing a patient go through the journey, and at the end of the journey, when they look in the mirror, they see themselves and they feel restored, and that's just very meaningful to be a part of that.
Mm-hmm. And I have received a lot of attention through gynecologists or when I go get mammograms, and they recognize that as they can't believe that I've been reconstructed. I would recommend Dr. Fisher to friends and family because I feel you're really compassionate about your job. And also, you're a great surgeon.
Oh, thank you.
You know what you want, you know how you'd like it done, and you have a goal. And I felt like you were focused on what I needed and what I wanted to happen. And I think that was really important to me.
Oh, I'm so glad. It's really, as a provider, I care a great deal, and I do about the patients, and I do feel like the patients have become a part of my family when I'm caring for them. Each person that I see, even years later, I think about people. How are they? I wonder how I'd like to see them, or, I'm happy when I do see them. I like to know that people are well, and I like to be part of helping people feel well. And when I'm really trying to get to know a patient for the first time, it's so important to me to understand how they see themselves and what's important to them and what their goals are, so that I can help them kind of achieve what they're looking for safely. Because the safety and then understanding what's important to them are two very important parts of making a plan for the patient.
My favorite memory of Dr. Fisher, I have many, but my favorite is I did recommend a friend who was BRCA positive to your office, and she had the same surgery, and I was trying to help out my friend, and I would stay the night with her, and I would listen to her stories, just to listen, and she would share the things that meant the most to her was that Dr. Fisher checked in on her, treated her like she was a person, and said good morning, and I just love that. I love
You mean in the
that.
hospital?
In the hospital.
Sometimes I do call the hospital room. Are you okay?
And it's little things, but I think the person feels a lot more comfortable and feels safe. And I think that sense of safety is crucial.
I have to do.
And because this is a scary thing. And for a person to feel like they're solid and grounded and they made the right decision, I think is important. So I love that.
Oh, thank you.
Mm-hmm.